Thanks for being with us here today, everyone. We have an opening statement from Premier Scott Moe, then a statement from Dr. Shahab providing a case update, and then we have time for questions. Premier Moe.
Well, thank you very much, and let me begin by offering our deepest condolences to the family and the friends of two Saskatchewan residents who have now lost their lives to COVID-19, and I am so sorry for your loss. The thoughts of all Saskatchewan people are with you at this very difficult time. Today's sad news is a sobering reminder for us all that COVID-19 is a dangerous and a deadly disease, and that we have to keep making efforts to reduce the spread, and we need to continue to adhere to the measures that are in place. And I want to take a moment to thank all of you across the province of Saskatchewan for what you are doing to control the spread of COVID-19. It is having an impact, but we are a long ways from being through this yet, so we have to keep going. Physical distancing, self-isolation, working from home, avoiding large gatherings, washing your hands and washing them often. These measures are working, but we have to keep doing them. Over the weekend, we saw an increase in confirmed cases, and that was expected. It's not necessarily a bad thing because we are doing a lot of testing in Saskatchewan. So it means that we are identifying and we are isolating positive cases. More cases means we need to increase our contact tracing efforts. And to date, we have been keeping up with our contact tracing. But now is time for us to redouble our efforts. We currently had up to about 150 staff that have been working on contact tracing in the province. And in the coming days, we will be reassigning an additional 50 more Ministry of Health employees, as well as other Government of Saskatchewan staff, to continue to expand our contact tracing efforts. We'll be constantly reassessing, and we will reassign more staff if it is necessary in the days ahead. So I know Dr. Shahab will have a few more things to say about both the new cases as well as the testing and contact tracing specifically in a few moments. Just before I turn it over to Dr. Shahab, I would say this. I know this has been a very, very stressful time for all of us in Saskatchewan. And I would say that in addition to our physical health, we all need to make extra efforts to look after our mental health as well. So I just want to remind everyone that if you are suffering from mental health challenges and stresses at this time, depression or substance abuse, that there are many supports that you will be able to access. You can call your family physician. You can get in touch with mental health supports in your area of the province and in your community, or you can call the 811 health line and they will put you in touch with the help that you may require. Once again, I just want to say thank you to everyone in Saskatchewan for doing your part, observing the many restrictions and the physical distancing rules during this very crucial time. And let me say that your actions are making a difference. So thank you very much for what you're doing. Dr. Shahab?
Thank you, Premier. So I would also like to express my condolences for the two deaths in Saskatchewan. Like the Premier said, this is kind of a sad milestone in our fight against COVID-19. I would also like to state that what we are seeing is certainly very sad, but it's not unexpected because now it's been 3 weeks or more since we've started reporting cases in Saskatchewan. And we have to remember, while it's very unfortunate that in some cases, unfortunately, there are deaths, but we also have to look that now we have a total of 14 people who have recovered as well. So as we move along, we will continue to see more hospitalizations and deaths, but also a greater number of people who will recover. As the Premier said, we are now entering into a phase where we are getting travel-related cases, but we're also regularly getting cases that are linked to community transmission. We really hope that over the next 2 weeks or so, our cases who are linked to gatherings or events will diminish because there really aren't a lot of gatherings happening. And we really want all of us to play a role in minimizing community transmission. Obviously, if you have any symptoms, you should stay home, even if it's a cough. If you develop a fever, aches and pains, chills, you should call Healthline, get assessed to see if you should get tested. There are numerous testing centers that have been established throughout Saskatchewan. If you are a close contact of a case or you've traveled from overseas, you must stay home for 2 weeks. You should not go shopping. But for all of us, this physical distancing is essential. Remaining connected socially, but being physically distant. Minimize interactions between households. If you meet people or go for a walk, maintain that 2 meter separation. Do not share meals with each other as neighbors and friends. It is very difficult for us in Saskatchewan. We often meet over meals, but this is not the time. And I think if we can sustain this over the next few weeks, that will be critical in order to flatten the curve. And while we will see cases and unfortunately hospitalizations and deaths, we want to keep that as low as we possibly can. Thank you.
Thank you, Dr. Shahab. We now have time for questions. We'll take our first question from the phone line operator.
We have Murray Mandrick with the Leader Post.
Hello, can you hear me, please?
Yes.
Hi, it's Murray Mandrick for the Leader Post. Question for both Premier Moe and Dr. Shahab, and I'd like to have it answered by each if possible. 3 weeks ago, we were looking at a situation where we weren't moving quickly. We were still talking about the Juno Awards going forward. There was still lots of talk about the possibility of a spring election. There was no talk about school closures. Other provinces did move faster. We've obviously moved faster in the last couple of weeks to rectify that. To both Dr. Shahab and Premier Moe, do you regret, in light of today's events, not moving faster initially?
Well, I think in this province we have moved at the appropriate time. To be quite frank, it isn't that long ago that we had our first case in the province, and we have advanced into the curve like many other provinces across the nation. But you speak to an important point, Murray, and that is the fact that decisions that you make on one day really don't have an impact for likely about 14 days into the future before you're able to see the impact of that decision. So we're about, I believe, 14 days from today when we closed our K-12 schools, if memory serves me correctly. And so, much of the impact with respect to self-isolation for travelers came shortly after that. Much of the impact with respect to physical distancing and encouraging people to work from home has all come within the last, let's say, 14 to 17 days. And that was when we started to have cases present themselves here in the province. So I think it has been appropriate thus far. We may have to do more in the days ahead, but we're also hopeful that the decisions that we have made will have an impact starting in the not too distant future. I was home this weekend for a couple of days, and I can tell you that in the community where I live, the activity out and about is very, very different than it was even 10 days ago, 2 weeks ago, for sure. People are very much respecting the restrictions that are in place. I thank them for that, and we're very hopeful that it will provide us with the opportunity to flatten the curve, and we're hopeful that will become evident in the next number of days. Dr. Shah, anything to add?
Well, all I would say, Murray, is that we actually had very few cases compared to many other provinces when we moved ahead with significant steps. And at that time, actually, we were being questioned about, is this sustainable? But, like the Premier said, we have seen, all of us have seen great compliance with these recommendations. I think there's a lot of personal responsibility that individuals are taking. There's a lot of compassion and thoughtfulness that people are taking towards, helping others out, but also staying out of each other's way. Figuratively, literally, as you see people walking, they'll move out of each other's way, greet each other, but move out of each other's way, but also remain connected and be willing to help. So I think personally we've done as much as we could, as fast as we could, but it's really important to sustain this. And I think we need to keep sustaining this for the next little while and keep reevaluating based on cases that now present to try to better understand what are the settings, what can we do more based on the cases that will now present over the next 2 weeks, better understanding of those situations.
Murray, do you have a follow-up?
No, let's just move ahead.
Our next question on the line, operator.
We have Bonnie Allen with CBC.
Yes, can you hear me?
Yes.
Hello, can you hear me?
Yes, we got you, Bonnie.
Okay, I have two questions about long-term care homes specifically. So of the cases that have been identified so far and the deaths, how many, if any, are residents of long-term care homes, and have any clusters related to care homes been identified?
So as of today, we are not aware of any cases in long-term care homes. But having said that, we already know that several provinces have had outbreaks in long-term care homes, and that absolutely is the most vulnerable population. And so we have been actually one of the provinces having significant restrictions on visitations to long-term care homes. It is heartbreaking for families to not be able to visit as frequently as they want to, but it is essential that we keep our family and loved ones safe by staying away for the next little while as much as we possibly can.
Do you have a follow-up, Bonnie?
Yeah, my follow-up is, in Alberta, some long-term care homes have decided that if their residents are symptomatic of COVID-19 or diagnosed, they will be treated in place versus being transported to hospitals. So what directives has Provincial Health Department put in place for residents of care homes to be treated in place versus taken to hospital?
I think that's a really important question, and I already know that all long-term care homes have looked at directives by the residents and their families, and in that sense, COVID-19 is not unlike influenza, that whenever we get influenza outbreaks in long-term care facilities, and they happen every year, unfortunately, there are several residents who become seriously unwell and pass away. Not all residents express a wish, or the families express a wish for transfer to hospital. Many families want a setting where there's all kinds of palliative care that's provided. However, if the wishes of the resident or the family is to provide a high level of care based on both the family wishes and also health and other conditions, certainly that care is provided. So it really does depend on a patient-by-patient basis, but certainly based on the family's wishes and other advanced directives, both care in place is appropriate for COVID-19, just as it is for influenza, and if and when required, transfer to an acute care facility is also appropriate.
I think we also have Dr. Shaw and Scott Livingston on the line. Would either of you like to add anything to that question?
Good afternoon. It's Susan Shaw. Scott Livingstone is still trying to connect. I don't think I have anything to add to Dr. Shahab's comments.
We'll take our next question from the floor. Steph?
Yes, Dr. Shahab, I want to use, one of the two deaths was travel-related. It doesn't say the same for the other one. So was the second death, was that community transmission related?
Yeah. So we're completing the investigations on the second death, but what we know so far is that there was no link to the individual with international travel. There may have been some links with family either in Saskatchewan or in neighboring provinces, but yes, there was no link to international travel. And like I said, we now are increasingly seeing cases that have no link to travel. So we are seeing a phase where we are seeing more and more community transmission.
And just to be clear, for the sake of how we should report this, are you calling it community transmission for the second death, or are you saying it's the investigation is still ongoing?
Well, at this point, we are calling it community transmission, but like I said, in previous discussions, we do try to gather. Obviously, it's a hard time for the family, and we have to do it this very sensitively, but we do try to gather further information as much as we can to see if there was a link to another case or to an event or travel. But at this point, we don't have that, which is a day after
Mr. Premier, I want to ask, why have we seen no announcements from your government for support for some of the most vulnerable residents in Saskatchewan? These are people who are street involved, homeless, kids who are aging out of care, who have a hard time finding housing in the wake of this pandemic. Why have we seen no announcements for support or added help for them in the wake of this?
Don't interpret not having an announcement for work not being done. The Minister of Social Services has been in touch with those organizations that are providing those services in our community shelters, etc. Been in touch with them, ensuring that the processes are going into place to support those that are most vulnerable in our communities. He'll be coming forward very shortly, as early as tomorrow, with a comprehensive plan, if you will, leveraging our existing assets, but also adding to those assets, ensuring that people in this province that are some of the most vulnerable people in this province don't need to be on the street at any time, but most certainly don't need to be on the street during this time of a pandemic. So that work has been going on. He'll be coming forward with a formal announcement tomorrow.
Operator, we'll take our next question from the line.
We have Mark Smith with CTV.
Is the province confident in the number of tests it has, and is there any plan to increase testing in the province moving forward?
Sure. I'll just say a couple of words with respect to that. That's a great question, and then I'll ask Dr. Shahab to get into a little more detail. The fact of the matter is that Saskatchewan, as I understand it today, has performed the second highest number of tests per capita of any province in the country. We're proud of that, but in saying that, there is still remains more to do. We were focused in the early days and weeks with respect to testing those that had a travel history. With us now transitioning, if you will, to the second phase of now having community transmission in the province, we are now focusing our tests into that area, into the community transmission area, as well as focusing our efforts, as I said in my opening comments, into contact tracing. So ensuring that we are tracking down those individuals that may have come in contact with someone that has since tested positive for COVID-19. We'll have very shortly in the neighborhood of about 200 people within government that are working very hard on that contact tracing and tracking down those individuals to inform them that they may have been in contact with someone that tested positive and ultimately may require a test. So we have tested per capita in very large amounts, the second highest in the nation thus far. In saying that, we do need to shift in the days ahead and are shifting actively towards putting our resources into contact tracing and focusing those tests into those areas to ensure that we are testing the right individuals, if you will. Dr. Shahab, anything to add?
The only recommendation that I would make is that obviously if you have significant symptoms and have not traveled, testing is very important. Once you test positive, then you are in isolation. There's contact tracing. Those are key pillars of containing this outbreak. But for everyone else, staying at home, unless you have to go out for essential shopping, not interacting among households, and at the first sign of even mild symptoms, maybe you don't feel sick enough to call Healthline, and that's fine. Isolating yourself till your symptoms have gone away. Obviously, if they get worse, you should call Healthline to discuss testing. But if your symptoms are mild, staying home for those few days is essential, because it may be a viral illness where by staying home you prevent transmission of another viral illness. But if it's COVID-19 and it's too mild to become significant to require testing, just by staying home for those days, a week or week and a half, will further minimize any risk of transmission, even if mildly symptomatic. I think all three, physical distancing at all time, staying home even with mild symptoms, and then obviously with significant symptoms, fever, chills, cough, discussing with Healthline your testing options, and testing is now available widely throughout the province. I think those all three are essential steps that all of us need to be aware of and take.
Do you have a follow-up, Mark?
Yes, on another subject, but the Manitoba government has set up checkpoints along the Saskatchewan border asking people if they've traveled and if they're showing any symptoms. What are your thoughts on this move, and has Saskatchewan considered doing this at all?
Not to this point. We haven't considered check stops, although we have made the recommendation that people should not be traveling interprovincially. I think all provinces and territories collectively have made that recommendation. This is not a time for us to be traveling interprovincially unless it is absolutely necessary for work or for some reason that is existential. But this is not a time to be traveling interprovincially and spreading COVID-19 between our provinces. So I understand the province of Manitoba has set up some check stops. I believe we've looked into some communications in the way of billboards, things of that nature, but have not considered check stops to this point.
Operator, we'll take our next question from the line.
We have Adriana Christensen with CJME.
Hi, I just want to ask if any of the people who have tested positive have been quarantined anywhere other than home, such as in hotels, and if so, how many would be quarantined in a place like a hotel, and where are they? Also, what are the protocols for that?
Thank you. So at this point, I'm not aware of any situation like that, but certainly the government of Saskatchewan and the SHA and our partners through Public Safety Canada, we are looking at all options to support individuals isolating themselves as much as possible in their home, but if that's not possible, other alternatives can be considered. But as we have seen with most of our cases, staying at home, separating yourself from others in the household, most people recover in 2 weeks very uneventfully, and no one in the household gets sick. So it is perfectly acceptable to self-isolate in the house, have others in the household separated from where you are, and in most cases there is no transmission within the household, and everyone is free after 2 weeks.
Do you have a follow-up, Adriana?
Yeah, so in the event that anyone does move to be quarantined in a hospital, for example, if healthcare workers who would test positive might be quarantined there, does the public have a right to know where they would be if they were in an area like a hotel and not in their own individual homes?
So what I would recommend is that as long as people are self-isolating in a home or in a other facility, either if they're asymptomatic and are under self-isolation for 2 weeks, or they're symptomatic, it is always done under the supervision of public health in a way that there should be no risk to anyone else, whether it's a public facility or whether it's a healthcare facility or any other facility. All those things are looked at very closely by public health, and we would absolutely not flag that someone is isolated in a certain public facility. But at this point, that situation does not exist in Saskatchewan.
We'll take our next question from the line.
We have Roberta Bell with Global.
Hi, could you confirm whether or not any of the ICU cases we've seen so far have recovered?
I would not have that information at this time. Dr. Shaw, would you have that information?
I know that based on the numbers that have been reported, there have been patients who have been able to successfully leave the intensive care unit, but that's the level of understanding I have at this time.
Do you have a follow-up, Roberta?
Will you be releasing in specifically what zones or areas of the province that the deaths, that the patients who have died, what areas of Saskatchewan that occurred in?
So I think we need to realize that, first of all, I think we do not want to release any further information about where deaths have occurred. You know, it's a very stressful time, a sad time for family, and we don't want to do anything that would invade their privacy. But even though we do show our total case numbers by regions of the province, the testing numbers are good to show because we want to make sure testing is accessible throughout the province. Case numbers, while we do show them because there's some interest in the public, it is of no value. So if I live in a part of the province where there's less cases, it may be because there's a lower population density. The case rate actually is very similar throughout the province. And it does not help in changing my behavior anyway, because I have to behave exactly the same anywhere in the province in terms of physical distancing, staying home if I'm sick, seeking testing if I get symptoms. So I think it's really important to realize that we really shouldn't look at the map and say, oh, my risk is lower or higher today. It actually does not change in terms of where the cases are.
We'll take our next question from the floor. Steph?
Mr. Premier, are you concerned about the safety implications of basically no longer limiting the amount of hours certain commercial truckers can be on the roads? Like, I understand they have to take these essential goods and there is a real need for them, but are you not concerned about the safety risks that might be creating by removing their kind of hours of service regulations?
Right. So yeah, there's been some changes made, announced this morning with respect to the hours of service so that we can ensure that the essential goods and services and the goods to provide the essential services in our communities can be delivered on time in this time of when we're dealing across society with the pandemic. This is a temporary relaxing of those regulations, and it's done so mirroring a federal change that was made, a federal policy that was put forward on a temporary basis. And so we've done it, A, to ensure that we can get those supplies into our communities, and B, to ensure that where we can, we're aligned across the nation, in particular with an in-depth and integrated supply chain system that we have across Canada and across North America. So it's not a decision that came about lightly, but it is a decision that aligns us with the rest of Canada and aligns us, ensures that we will get the supply chain goods into our communities.
I mean, you still didn't really answer my questions. Are you not concerned about the safety risk this could create in light of the trucking tragedy? I mean, we saw in this province, coming up on a 2-year anniversary of it. So, I mean, why would you kind of?
Yeah, I'm not certain with respect, and not to speak to that tragedy, the Humboldt Broncos tragedy that we had in Saskatchewan that we all know so very well, that the hours of service were the issue with respect to that tragedy. I don't know, but the fact of the matter is that what we've done here is we are aligning with the Canadian policy, the Canadian regulations that have been relaxed for a short period of time. We have done it for one reason and one reason only, and that's to ensure that we can have the supply of our essential goods into our communities, medicals, goods, for example, medical supplies and other goods that we need in order to carry on, the essential services that we need in each of our communities. There are things that we need that we don't often think about with respect to chemicals to treat our water in our communities, for example, and treat our wastewater. There are all of the medical supplies as well as our food that need to continue to be delivered. And we are under a time of, we're operating in this province and across the nation under, and in most provinces and territories, under emergency measures for the most part. And I don't know if that has occurred for certain, not in my lifetime, but not for the distant past, which speaks to the severity of this situation and speaks to the fact that we do need to ensure that our communities have the supplies they need to operate and operate safely, to address the pandemic, but also to address community safety. So we've chosen to mirror the federal standards that are there. Always concerned about safety. That's why we have put forward some of the strictest trucking regulations, as well as regulations on our roads to keep our families safe in the way of distracted driving, impaired driving, and other initiatives. So we are concerned about safety each and every day on our roads, and equally concerned with respect to what this regulatory change. We'll be watching it very closely as well, for sure, because we are concerned about safety on an ongoing daily basis.
We have a couple more questions on the line, operator.
We have Adam Hunter with CBC.
Hi, I'm wondering for the Dr. Shahab, what's the reason for this disparity in a number of tests being done or been done to this point in Saskatoon versus Regina? I think there's 1,500 more tests that performed, and there's also many more tests, I think 50 as of today, pending in Regina versus only 6 in Saskatoon. Can you explain why the disparity is?
So there is always a variation in terms of if there's, as we discussed, when there's case contact tracing, depending on how many contacts are found, there's always a spike in testing based on those things. But I haven't looked at I haven't noticed the disparity you're mentioning. The other thing, of course, is that if you look at throughout the province, the population numbers vary, so the testing numbers vary, but the testing rate may not be that different. But I will look into it a bit more and can maybe see if there's anything that's unusual, and I can speak to that on Wednesday.
You have a follow-up, Adam?
No, that's fine.
We have time for one more question on the line, operator.
We have Phil Tank with the Star Phoenix.
Yeah, the Premier said what people are doing right now is making an impact. I'd like to know, whether we see anything in the numbers, whether you think the numbers, we obviously saw a lot of increases in the last 3 days, 72 new cases. For both the Premier and Dr. Shahab, what should we read into those numbers?
What I would read into those numbers is you're seeing this weekend and into the next week, some of the more final days before some of our restrictions came into place. If you go back about 14, 15 days, it's just prior to when our restrictions started to come into place here in the province. And I would say they probably took about a week to really get up and to be fully implemented at the community level and at the society level. I said I was home this weekend. When I compare the activity on the streets in my home community or even here in Regina to a couple of weeks ago, things have markedly changed. And I think we should take the opportunity to thank the people of the province for adhering to the restrictions that have been put in place. Second, I would say that as we look ahead, the next, into the next week or so, that we would hope that the rate of increase, and we will see when we get there, and we may have to put in additional restrictions as we approach this, but we would hope that we start to see a leveling of at least or a slowing in the rate of increase of our positive IDs across the province here. We feel we have done a good job, as good as virtually anyone in the nation with respect to the number of tests that we have performed. We also feel that we have focused those tests into the areas of society where they need to be focused. But we also feel that putting forward restrictions such as mandatory 14-day isolation if you've had any international travel are also very, very effective. Restrictions in the way of physical distancing and the number of people that can gather in any one place. So the numbers that we are seeing this weekend and quite likely over the next few days, I feel would be indicative of the last number of days prior to restrictions being put in place. I'm hopeful and that we will start to see a bending or a flattening of the curve as we start to see some of the results from the first number of days into our restrictions that were put in place. So we have, put restrictions in place what I feel is at an appropriate time. We have had a very solid testing program. I believe we have almost 40 testing locations across the province today. We are now shifting with the focus of that testing away from international travel and more into those that have symptoms and have been in contact with someone that has tested positive for COVID-19. So we feel confident that we are making the appropriate decisions as we go along, and we're hoping that will bear out in the numbers over the course of the next week to 2 weeks. Anything to add, Dr. Shahab?
Yeah, I'll just maybe just expand a little bit that, like the Premier said, we obviously have no control over people coming into Canada from other provinces or out externally, but we already know that long-term people, snowbirds, are coming in, so that will continue for a while. The federal government has assured us that there is minimum travel happening now with people leaving Canada for a non-essential travel and then coming back, but that obviously we need to all pay attention, and we all need to make sure that we do not travel right now for non-essential travel internationally. I think that is very important in terms of slowing the numbers through importation. And we also have to remember that, like the Premier said, because we don't expect any mass events happening, we also don't expect to see large numbers of cases linked to any gatherings of mass events. But like Dr. Shaw sent, I think, a message out about all of us being the 13th man for the health system, I think that's really important as well, because if you do nothing, each one of us infects 3 other people. And that within 10 weeks, you have 59,000 people. And that's startling, but that's how fast COVID-19 moves. But if each of us practices meticulous social distancing, self-isolation if you're in contact of a case or if we've traveled, very stringent isolation in a part of the home if we are a case, then you infect no one. And that is how we stop this. And I think that is absolutely essential. And it's essential, it's more essential now than it's ever been. And, we can't stress this enough.
Do you have a follow-up, Phil?
Yeah, just I suppose for Dr. Shahab, how do you track recoveries? Are people actually examined, or are they just reporting? I mean, I'm guessing you keep in touch with all the cases, and I'm just wondering how that works.
Yeah, that's a really important question, and just to inform the public that initially, of course, in the early stages, public health would follow up on a daily basis people who were in home isolation, and at the end of 2 weeks, once there were no symptoms, they were swabbed once, and then if the swab was negative, swabbed again after 24 hours. We have since learned from our own experience and from the experience of other provinces that for mild cases where after 14 days of the onset of symptoms, where people are totally symptom-free for several days, there's no need to swab. So now many cases will be cleared just through a health assessment and may not require swabbing. There may be different rules that may apply for healthcare workers, especially if they have to go and work in a hospital setting. But certainly the good news is that for the vast majority of cases going forwards, as long as they have had a mild illness, 14 days after the onset of illness, if they've been symptom-free for a few days, because symptoms usually last, 7 or 8 days. So if they've been symptom-free for a few days more, and we use the rule of 14 days after the onset of symptoms, they are then declared non-infectious by public health.
That concludes the time we have for today. Thank you very much, everyone.